Good afternoon and welcome to our webinar. I'd love to welcome you today. I'm Jennifer Perry, Managing Principal at FMG Leading, a strategic advisory firm committed to the transformation of healthcare through its leaders and people. And today we are focusing on a panel entitled Leveling Up: Leadership Strategies to Bridge the Internal Trust Gap and Strengthen Healthcare Operations. Today we have a diverse and seasoned panel of leaders, and we want to explore with them the current trust gap that we are seeing within healthcare organizations, really at a number of levels, but especially the gap between senior leaders and frontline workforce, as well as between executives and physicians, clinicians. We'll discuss what's causing that and what do leaders and organizations need to be doing differently to both address that gap and also better level up and prepare leaders to navigate today's complex challenges. Our goal is to really illuminate these challenges and share some strategies and practices to help all of you address them. So I'd like to invite our panelists to introduce themselves and share your title, organization, and a brief sentence or two about yourselves for our audience today. So let's start with Dr. Harrington.
Hello, I'm Cindy Harrington. I am a congenital heart surgeon at Children's Hospital Los Angeles. And I have a few other things that I do for CHLA. I have a place in gender equity in the Office of Diversity, Equity, and Inclusion here. And I also sponsor a leadership training program at CHLA called Kaleidoscope.
Thank you. Dr. Mosley.
Thank you. Katora Hall Mosley, and I am at Seattle Children's, and I'm the Vice President of People Experience and Talent Development. And so I've been in the space of healthcare for really the past 8 years and focused on growing leaders and really helping support creating workplaces that people want to grow and thrive in.
Wonderful. Thank you. John Hill.
Hi, everyone. My name is John Hill. I'm a principal executive advisor with FMG Leading, and I serve clients in our healthcare practice. A little bit about my background. I've served for 25 years as a healthcare executive, working in highly competitive urban markets, small community markets as well. And early in my career, I also worked in a private medical group practice, which was fantastic. My most recent experience, I was CEO of Bozeman Health in beautiful southwestern Montana. It's great to be with you. I look forward to the conversation.
Great, thanks. And finally, Leslie.
Hello, everyone. Great to see you today. My name is Leslie Solomon. I'm a principal with FMG Leading, focused primarily on applied leadership development. Prior to joining FMG Leading, I had about a 20-odd year career in the healthcare ecosystem, working in acute care environments, working in biotech, working in pharmacy and medical devices.
Wonderful. Well, thank you all for being here today and welcome. So let's get into this. We know trust matters. Many studies show that positive correlation between high trust environments and engagement and other organizational metrics. In fact, recently, the Great Place to Work Institute found that trust between managers and employees is the primary defining characteristic of the very best workplaces, defined by things like productivity, engagement, number of sick days, overall performance. We also know that today a huge trust gap exists in healthcare organizations. In fact, 2 recent studies found Qualtrics, who measures patient and employee experience, that nearly half of healthcare workers today don't trust their leaders. And JAMA recently published something that says 1/3 of physicians do not trust their organization's leadership. And anecdotally, we're hearing these gaps are widening across the healthcare ecosystem. So I'd love to explore with our panelists, how would you each describe what's driving that trust gap in healthcare today, both its causes and its impact? Dr. Harrington, love to maybe hear from you first and would love to have everyone weigh in on this.
So it's such a large topic to kick off. But as I listen to your description and I think a lot about my own experience, I've been a cardiac surgeon now for 25 years and in 2 different healthcare systems. And I would agree with the sense that the trust gap is widening, because when you said 1/3, it doesn't feel like 1/3. It feels like that's a kind way of saying that we have a trust gap. And I can think of all different ways that we can engender trust. But I also am cognizant of the fact that I can really only give you a response from my perspective. And I do think that as new generations enter healthcare, the way they trust may be different. For myself, I will extend to people that I don't even know a certain amount of basic trust, which they can earn more of or they can lose. And then I gauge it as the relationship grows, and there are certain things that can help that relationship grow, like honest conversation and learning a little bit about each other and delivering. Like when I show up and I deliver on something that I say I'm going to deliver on, I feel like that engenders more trust with the people that I lead. So, but I am seeing that there is some generational differences. Some of my colleagues come in and they're like, there is zero trust if you're in administration at this hospital, and you got to earn every single bit of it. And so I think I can really only give you my perspective, but it does feel to me like the gap is widening at a time where it's really crucial for us to be able to work together. So that would be how I would start that.
Thank you. Yeah, Keturah, anything you'd add to that in terms of what you're seeing as some of the potential causes related to that and the impact?
Yes, absolutely. I mean, what Dr. Harrington said resonates deeply. And I would add that it's so busy in healthcare. There is so much coming at us day to day. And I think people are working, all of us, we're working really hard to do our best and be our best and to accomplish a lot. And I think that when we think about how trust is built of really relationships and getting to know each other in moment and through moments, time over time, that's kind of put by the wayside to get things done. And so we know that we have a lot to do within healthcare, and there again is a lot coming at us. And I think it's so important to make sure that we prioritize getting to know individuals. But I believe it's that time and the multiple priorities that we have.
Right. Others, John, Leslie?
I would offer, it's implied in both what Dr. Harrington spoke to and Keturah spoke to, is that there are baked in cultural differences that drive the potential for mistrust. And so, Cindy, you were talking about where physicians sit. What I saw as a former hospital administrator is that administrators come and go. And the physicians sort of hold the institutional memory, and they hold the stories of every administration that's been in and out. And some of that level of change does create a wider trust gap. And it's not about character as much as it is this sticky? Is it enduring? What do I believe in? And I do see that now extending more into the whole clinical domain with nursing because of the labor shortages and the fact that labor force also is shifting a lot.
Yeah, and I would build on Leslie's comments. There's been so much change over the last 4 years in healthcare. Obviously, the pandemic was an extraordinary time because in many respects, we put on the shelf our policy and procedures, the old hierarchy of leadership structure, the way that we used to do things completely dissolved during the pandemic, and we let our clinical teams lead. After the pandemic, coming through into what we now know as the financial crisis, which resulted from the pandemic, I believe the industry over-indexed back on policy and procedures, the hierarchical way of leading through that structure. And I think with all of the change, the complexion of our workforce changing, with really experienced healthcare workers leaving, new teams coming in, that just doesn't work anymore. And I think that's another big driver why the trust gap is widening in our industry.
Yeah, I think that resonates, and having to make tough choices and communication as an aspect of how do you communicate and share that to the organization so they understand it, which we know impacts trust as well. So, recognizing that, I guess, what are you all seeing as critical to building trust and some of the strategies and tactics to overcome or help close that trust gap? Katara, I'd love to hear from you, and then we can have a few more weigh in.
Yeah, happy to start us off. And I think really some of the things that I've seen, I talked about relationships and connecting. And I think where I've seen things done really well is the deliberate, intentional focus on reaching out and asking for thoughts and opinions and perspectives, and then circling back and sharing how that information influenced or impacted decisions. And I think that is a key piece. And it happens over time. It just happens one time and then, oh, trust is built and we're done. It's a continuous strategy of which, thinking about my background in organizational development, it's something that we have to make sure that we're communicating. Here's how we're reaching out and asking for different perspectives and opinions and sharing how everyone can be part of really growing and building the organization.
100%.
Could I add on to what Katura is saying? And I'm going to pull in a little bit about what John said too, because it so resonated with me when you talked about, like, during the pandemic, we were letting the physicians lead. So during the pandemic, we felt like you heard what we had to say. Because, for whatever reason, we felt very heard and we felt like we were able to help drive the institution in a safe way. And now we feel like we're back to not really being heard again. Not really that people, because now it's the business of medicine, and maybe, we're not listening quite so strongly to the physicians. But I would say what I have seen to be incredibly effective at building trust happened here in our institution. Our CEO, Mr. Paul Viviano, when he was new and people were just getting to know him, there was a lot of commotion about, well, have you met him? I haven't met him. Who was on the committee? Do you know? Like, can we trust him? Because he came from the business side. He wasn't a physician CEO, which I think if you're a physician who became a CEO, there might be a little bit of trust that comes with that. But what he did was he really dug into the mission, values, and vision of the institution. And our institution, sorry, is very, very aligned on what our vision is and what our mission is. And we're a safety net hospital. And previously that was considered a bad thing. And the physicians had some difficulty with that because we want to take care of everybody that comes to the door. And when Mr. Viviano got here, he aligned with that. He was proud of the fact that this is what type of a hospital we are. He was proud of the fact that we were going to take care of every patient that came through the door. And he acted on that. And that instilled a lot of trust early on in his development, and it really helped bring physicians closer to the C-suite and the workings of the C-suite. So I thought that was really important.
Yeah, I think two things I've heard from both of you. One is listening, right? So the multidimensional listening that needs to happen, not just the standard we'll do some rounds or a town hall, but really the listening, and then also the connecting to purpose. So I'm curious, John, just from having been in the C-suite perspective, I'd love to hear your thoughts on those things.
Yeah, I just think addressing the trust gap and building as much trust as we possibly can across the industry, it's a moral imperative. If we think about healthcare organizations, their entire energy, focus, resources, the people are all aligned towards caring for patients and creating healthier communities. And all of a sudden, this trust gap has distracted from that very purpose. And I think when we approach this topic as leaders, we have to think about it as that moral imperative. And so a few things that I would just elevate, and Dr. Harrington said it beautifully. I think as executive leaders specifically, as we think about how to engender, repair, elevate, or try to bridge this trust gap, it really does rely on us to get into the mindset, which I think all of us were called to, which is we need to be patient-centric. We need to understand that this is all about the patient. When we walk into situations, we must have that as our frame of reference, and that should actually be one of our key messages. How do we rebuild trust so that we can better care for our patients? And I think that resonates for clinicians and non-clinicians as well. So maybe just a few quick tips that I have seen work. I've used this. I've seen other executives use this. First of all, that patient-centric mindset has to be who you are as you walk into areas of the organization. The other is walk into the areas of the organization where it's uncomfortable, where there's a lot of missing trust. Find those places, walk in and ask, what's happening here? What was the origin of this? Get to some root cause analysis. Do as much as you can to crowdsource. What are some of the solutions? I think leaders that apologize live in their integrity and in their truth. And I think if we've made a mistake, you must apologize. And then from there, I think it's really getting into what can we do now to create small wins? And I like to call those small moments of promises or small promises. What are things that we can do to, again, demonstrate that our words and our actions, which is how you build trust, will start to connect? And I think one of the ways we can do that is it's incredibly important to do it, but sometimes it's a little bit challenging if you're a CNO or a CEO or a CMO, because all of a sudden the directors or the frontline leaders are saying, hey, you're taking some of my authority to resolve some of these concerns and you're taking it to your level. I think shared leadership is a beautiful model where, these problems, although they're small promises, they have lots of different dimensions to them. So an executive can take one dimension, the frontline leader can take the other. The medical director in that unit or in that service can also work together in shared leadership. And if you think about it, the multiplying effect of several leaders working, even putting an hour into the solution, you all of a sudden can start to create scale. And you can do that across the organization where there's challenges. And then what I would say is the reliable feedback loops are also important. If a promise is made, you need to make sure that promise is kept. And then at the very end, repeat that as often as you can in the places where there's low trust. That would be my recommendation.
Yeah. Well, and I think one of the things you mentioned, John, that I think, I have seen is very critical is that connecting the dots, right? So as you're communicating the purpose and making certain decisions as leaders, how are you continually reinforcing how those relate back to the mission and purpose so people see that connection? Because leaders live in that all the time and feel like it's obvious. And my experience has been you have to be very, to Katura's point, intentional in your communication and connecting the dots for the organization. Yeah.
I would add one thing to that, and I loved what you said, John, and I could even visualize the practice of it and the consistent practice of it really being impactful. I think there's the other thing, which is how you show up to the conversation as a leader, and sometimes we call it presence or authenticity. So it's showing up and being willing to talk about who you are, what you value, and let people know, because everyone values the patient experience, but the particular connection, why it's important to you. I like to share sometimes the example of, I was working with a medical director in charge of quality where I used to be, and I had a glass of wine once and found out that his father had passed away from a hospital-acquired infection. And I said to him, have you ever told anyone that story? So like when you show up to talk about infection control, no, do you think I ought to? Yeah, I think you really need to, because it's these human connections that drive the trust, and knowing that people aren't just speaking a platitude, but something that is really meaningful to them.
Yeah, Leslie, I mean, speaking of that, I mean, you both are reflecting on authentic leadership and leading from your own values and your own purpose, and how important that is, right, for leaders to have that themselves, as well as connecting the folks in the organization to the organization's purpose. So I'd love to hear a little bit about, as you think about purpose, why it's so important to connect this work to purpose, trust building, relationship building, and the impact that can have in terms of building those connections with leadership.
Well, I happen to know that, Katura, you're writing a book on this, so I would venture to invite you to weigh in if you're comfortable.
Absolutely. Yes. Thank you, Leslie. I think really purpose we talk about with organizations, definitely, but also I think there's a unique piece about as an individual understanding and getting to know who you are and your purpose. And Leslie talked about it, of really showing people want to know who are you as a person. And I think that purpose is really the aim, the ambition, what drives you. And when individuals see it, that unlocks all sorts of leadership capacity as well as trust. And in that is trust. And as John highlighted, the actions that lead into the actual behaviors and really building that. And so I think one of the things that I've noticed when around purpose is when people understand and purpose, I think, can shift over time depending on what you're going through and what's being presented. And there's beauty in that, but recognizing and being in tune with who am I as a person and what allows me to do what I do. When you're in tune with that, it allows you to demonstrate that into the organization. And I think that's really what people are connected to. I believe, as Dr. Harrington said, we have a lot of different generations in the workplace. And I believe people want to do their best. They also want to belong and they also want to be seen and heard. And when you can articulate your purpose and bring and thread that through, and it looks different. Sometimes it's not, this is my exact purpose, but maybe for me, it's like a particular story of, I want to see you do well, or here's how I'm bringing out the best, or how I'm sharing my purpose with you. But people want to see what's the human side. And I think that's what we saw in COVID. We saw the human side. And I think in every crisis, there is opportunity. And I think we need to hang on to that piece and continue to make sure that it's front and center. And that's, I think, what builds trust and unlocks that leadership capacity, which is part of the focus in my book.
Thank you. I happen to know that Dr. Harrington also has done some work on purpose coming out of some of the programs. And, if I can even offer, posted something recently that went viral. But Cindy, Dr. Harrington, talk a little bit about kind of how you've approached purpose and the impact that's had on your leadership and how you think others can tap into that kind of power.
Yes, and Katura, I want a copy of your book when it's published because I think that that would be a very enjoyable read. I was asked to put a purpose statement together maybe 4 or 5 years ago, and I did recently dust that purpose statement off during Women's History Month when I was posting really some quotes that famous women have made on my site like every day to encourage other women. And I know that I'm not going to get off this call with Leslie unless I actually tell you what it is. So I will tell you what the purpose statement is, and then I'll tell you how it has impacted people and myself. So the statement goes something like this: I need to know that through my long career, as I blew through glass ceiling after glass ceiling and got cut to hell in the process, I made a big enough hole for the women who follow me to be able to make it through safely. And so people who know me as a female cardiac surgeon, I was a very early person to go into congenital, and there are a lot of women who have followed. And and I never know what's going to go viral on social media, and that got some movement. And colleagues from around the United States reached out to me about how it resonated with them. And interestingly enough, outside of medicine, there were some really powerful women in a group in Ohio who actually used it to kick off one of their women's conferences. And so it did get legs and had some traction. But when I look at, and mind you, I wrote that 5 years ago and it's been sitting and waiting. And so I dusted it off this year. But that really, for people who know me and people who work with me, they would say that statement really does embody how I show up and how I walk through my leadership, because my leadership has evolved, and I'm really at the place now where I feel like my purpose is this, and also to make sure that the next generation of women in surgery don't get cut to hell. Like our organizations change, they grow, and these women, if they want a seat at the table, they have a seat at the table. So.
Wonderful. That's super powerful. Thank you. John, I'd love to hear some of your perspective. You've been a leader for a long time and have led not only through your own purpose, but also connecting organizations to people to an organization's purpose. How is that powerful, and what are ways in which you've seen strategies to do that really can make a difference, knowing the impact that leaders have on organizations' culture, engagement, and connection?
Yeah. Gosh, I'm reluctant to say anything more because Dr. Harrington, that was incredible. So thank you for sharing that with us. And I couldn't agree more. I think if I were to offer anything, when it comes to purpose, I do believe that individuals are drawn to healthcare, whether it's to serve patients at the bedside or to serve our clinicians who serve patients at the bedside, because they want to make a difference in the lives of others. And I think there's a very beautiful purpose behind that. And I think for executive leaders, it's been mentioned several times, we're now in the business of medicine, and we're trying to do everything we can to sustain the organizations, to transform the organizations, to be ready for whatever comes next. And that's clearly having a toll, not only on our frontline care teams, it's having a toll on leadership. It's having a toll on executive leaders who had to make really tough decisions and impact people that they care deeply about, or an organization that they've cared deeply about. And I think the renewal of purpose, as was mentioned, is so important. And how I would do that, that's what I would offer, is in those really difficult times, I felt, going all the way back to when I was in high school, I was a certified nursing assistant. I was trained around the humanity of healthcare by really savvy critical care nurses. And I remember during times in the pandemic and other difficult times, if you can get to the bedside and allow a physician or a nurse to let you be with them, to be in that sacred space of where patients are cared for, the energy just flows through you. And I think if you can capture that, renew your purpose in that way, and then share that, which I loved, was encouraged, share that in the moments where it could help somebody else realign with their purpose. And I would just say this: if we can get the magic of some of the incredible clinical workflows and treatments that we provide, and the amazing spirit of people in healthcare, the power of that comes through purpose. And if we can all share that, we can do anything in this industry, including transforming to whatever next is in the future of healthcare delivery in the United States. And I think that's the power.
Well, and they say what leaders talk about, measure, and pay attention to is what reinforces what's important in an organization. And so just, again, back to how do leaders communicate that and are intentional around sharing those stories and the impact of those stories to reconnect people back to that. And we also, I think, know that, one of the number one issues cited by healthcare leaders right now is workforce issues and retention, and, throughput and operations performance as well, and the importance of leadership and its influence on that. And I think one of the things that we've entitled this panel is Leveling Up, right? The need for leaders to level up to meet those challenges. I'd love to hear from you all. What does it mean to you when we talk about leveling up, and some best practices healthcare organizations are doing to really invest in leaders to help achieve that in a more impactful and effective way? Leslie, I'd love to have you start and then hear from some others.
So the term leveling up, if it's created an image of you, of a little video game person grabbing a sword and going to the next level, that's where it comes from. And I love that imagery, because I do think that is the work, to what you were saying, John, that's the work we're called to as leaders all the time, which is, what do I need to deal with the complexity that's emerging in the landscape? And it's changing all the time. Your last question about connecting to purpose, this is a leveling up of how we think as well as how we behave. And it's also leveling up in terms of how we learn to manage ourselves in the process, because we haven't talked about it yet, but we're in a mental health crisis as well. And in healthcare, we are socialized to diagnose and fix. And so it is a largely critical thinking exercise day in and day out, surrounded by a lot of emotionality and often trauma. And so that those creative centers of our brain, those places where we kind of access imagination and pride and love and the things that really help us with mood and affect, part of leveling up is being intentional about accessing those things on a regular basis, and managing yourself so that you can continue, grab the next sword. And that's my thought. Of course, there are concrete skills as you level up, but I think I'm most fascinated by the thinking aspect of what it means. Yeah.
Great. Others? Tara, thoughts on that?
Yeah, I think to build on Leslie, I really appreciate the sword analogy of moving forward and moving to the next. And I think organizationally, some of the things that I've seen and been part of has been being really specific about here are the skill sets that we are going to develop and putting programs in place. And even beyond that, making sure that there's sponsorship that's set up. So people that will be there to talk about here's what I'm seeing of these individuals and how I can bring them along. And then also equipping people with information. So recognizing that there are, I think it's specifically in healthcare, it is hierarchical. And so recognizing that there are key decision makers, there is power in the room, but being very transparent about expectations and putting information in hands of leaders at all levels to be able to say, you are part of this and here's what you can communicate, to be able to share some in some of the difficult conversations and difficult information, and then connect too with other colleagues to do that too. So I think that really very clear, here is what we expect as we move forward, and helping other people really, that helps to level up, because sometimes it doesn't happen until we're in the midst of it and recognize, oh, this is what we need to do. Here's how we do it. And then we know that there are people that are going to back us up and support us to help us move forward. That also, I think, speaks to the leveling up.
Yeah, and I think I hear you saying, Katura, a really important point there, which is leaders don't have to have all the answers. And I think in the past, oftentimes leaders felt like they needed to have the answer. And I think going forward, right, there's a lot of new terrain to navigate. And I think organizations and employees, part of the trust piece is they know we don't have all the answers. And so being authentic about that is very powerful, and also kind of a, not your, as an old saying, it's not your father's way of leading. It's a new way of leading. But Dr. Harrington, any thoughts that you'd add related to that?
I thought Katura did a beautiful job with that. The only thing I would add is I agree with you. I think that really good leadership is a partnership, and like any healthy partnership, you've got the trust issues that we're talking about today, but you also have expectations of each other. And it's more of a relationship. And so relationships take intentional work to make sure that they are healthy. So I think all of those things come into play. And I like the concept of leveling up. And I like the fact that it's got this whole video game kind of connotation around it. And when I think about it too, and Leslie, you did touch on it about there are skills required, of course, to level up. You can't get to the sword unless you get to how you have certain skills. And so I think a little bit about what it means to expand laterally before I go directly up. And so medicine is built on a hierarchy, and we're trained from the very beginning that directly up is the way to go. But frequently you have to move to the sides to maybe get the skills that you need. Or like, for example, a plant that grows a little like this is doing that because the sun isn't shining right here, but it's shining over there. And so I do frequently tell people sometimes you need to make a lateral move, or you need to get some lateral skills before you can actually begin to go up. And so I really view it as like a growth piece. And I do agree with Katura, investing in our young leaders. The Kaleidoscope program is focused on early leadership journeys and young leaders, letting them know that they have leadership potential, helping them to have healthy leadership skills, I think are all really important pieces of investing in our own people, which I think is really crucial right now. And I would like to retain all of the talent. I am not in the mood to go out and get new talent all the time. And so retaining that talent by investing in young leaders or early leaders, I think is really crucial. I think organizations really need to look at that very carefully.
And Dr. Harrington, maybe you can speak a little bit further about the genesis of the Kaleidoscope program and how it came about and what your organization is trying to achieve with that and what you're seeing so far.
So this is a slightly different program in that it focuses on people that are early in their leadership journey. And so the program is looking for people who are either in their first leadership position or are leading on their team, but maybe their skills are not recognized by people around them, and or they have a desire to work with CHLA in another role and want to step into a leadership space. And so it really is early in the development. And we go, it's an immersive program. There are modules that we do together. There's training we do along the way. The program is kind of shaped around the need that we see with the cohort. It's had some really, I didn't anticipate that we were going to have the results that we had so early. So it has had some really good return, and some the metrics that we measure afterwards have all been very positive. And the nice thing with this program, as Keturah had mentioned, is each person that's in the program has a sponsor within the organization, and it's probably not going to be the person they directly report to. So we train sponsors, we train the people that they report to, we put them through the program. So when I graduate a class, I have 16 new leaders who are sitting in the space differently or perceiving their leadership differently. I have 16 healthy sponsors who have spent 2 years sponsoring and now know what healthy sponsorship looks like. And I have 16 directors, managers, supervisors who have watched these people grow and now have ways. They're like, yeah, this person is ready to do this now, or maybe I could ask this person to do this and move them along their leadership journey. And so the ripple effect in the culture is really has been profound, but it's located right at the time when young talent may decide to go someplace else to do the new thing, because I don't think I don't think there's a path for me to get to it here. So I'm going to leave and go to the other hospital down the street, and I'm going to do the new thing there. So I would much prefer that you let us help you with your leadership journey and you do the new and exciting thing here at CHLA and not go someplace else to do it.
Thank you. That's so powerful. And we know right now there's not only a shortage of clinicians, but also leaders as we think about the retirement age and being able to develop and nurture those leaders and the ripple effect. You're talking about building capacity at many, many levels. So Keturah, I'm curious, just how has Seattle Children's engaged in kind of investing in leader development and building that capacity as well? And what have you seen? And what are some of the conditions required for success?
So there's been quite a bit of a journey around it, and really looking at all different levels of leaders and individuals that are emerging and in process of wanting to lead, and thinking too from a clinician perspective as well, and physician perspective of how are we growing. And so we have a variety of different programs. And what I would say too is we've taken some time to really think about individuals that are growing and developing into the C-suite, and being deliberate based on a lot of work that's been done with health equity, and making sure that we're creating a diverse and inclusive culture, and how do we continue to sustain that. And so developing our leaders that are looking to move into the executive space and or are already there and looking to expand their scope, we've really spent time saying, okay, let's make sure that you understand who you are as an individual, that you're communicating that, and how is it that you model and lead authentically as well in some of these different challenging situations. And at the same time, continuing to develop individuals across the organization that maybe haven't or maybe in informal type of leadership roles, and making sure too that they know here's some ways to continue to grow. But I also align with what Dr. Harrington talked about, and that it's not always moving to, okay, I maybe am a lead, and then I go into a supervisor, so on and so forth, up to the CEO level. Sometimes there's not that options for specialty. Sometimes it's not what's desired. Sometimes it's not aligned to my purpose. Sometimes I just don't want that just based on where I am. And so we've done a lot of work too to just even start and have the conversation around what is my goal? What is my aim? And then what are the experiences that I can gather along the way to figure out where do I want to go across the organization?
So I'm hearing kind of a combination of working with individual leaders and helping them see their path, but also programmatically, right? Being clear on what are the capabilities you need to carry out your specific organization's mission, vision, and strategies and culture, and investing that in a tailored way, which I think is so powerful. Leslie, I know you had a chance to work with a number of organizations around investing in this kind of leveling up and leadership development at the dyad and physician level, at the individual leader level. What do you think are some conditions of success as organizations think about how to approach this?
Yeah, great question. Thank you. One condition of success is that, the person who is being asked to level up has to value learning and growing. And we talk a lot about learners' mindset. We talk about having a desire to keep growing and expand your thinking. So that's one, having a way to identify and invite in those learners. The second thing that I think is really important is that the work that you're doing expands, but it doesn't burden. So we're really intentional when we're doing programs to say, like, how are you going to level up? What are you going to do? And it could be in the way you're thinking. It could be on a project you're already working on. It is not about layering on extra work, because I think that's a fear, whether people say it or not, which is like, oh, so you just want me to do more. And that's another piece about leveling up, is to not have it be more, to have people who are willing to look at maybe not doing things that they're doing or doing things differently. So we use assessments, and I think assessment is another key part of leveling up, is getting feedback and knowing, what are you doing that's working? What are you doing that's not working? How do others see you? How could you adjust and be more effective? And that can be formal leadership 360s, or it can be personality inventories that just help you understand yourself better. Those are a couple of things. The other thing that Keturah mentioned earlier, which I think is really important, is it's scary to do this work. Because what if I don't do it right? And what if I'm visible now? And what if I, have a faux pas? So sponsorship, coaching, peer collaboration, all of those wraparounds really make it address the safety factor and build community around it. And I think that's another critical part of looking at ways to have people level up, is that they have community to do this growing with.
And I hear in that, Leslie, it's not only kind of learning skills, but it's how to be, right, and how to show up as a leader as well. John, would you add anything there, just from your experience and also seeing from, the important nature of this and different ways in which to approach it?
Yeah, well, I heard several comments around the investment in these programs, which I think is extraordinarily important. And a couple of things that are coming to mind, and I'm stating the obvious here, but healthcare is a people's business. It's service. It's all about people. And if you think about the investments that we make across our healthcare organizations, yes, there is an investment in salaries and wages and benefits and so forth. But I think it's incredibly important to keep the same discipline and the same rigor to say our number one strategy are our people, and how do we enable the highest potential from our teams? And that's through developing a world-class leadership team. And when you think about it, we have to have key outcomes and key metrics when we invest in these types of programs. But I heard something really enlightening for me, and I want to elevate that just a little bit. Early in my career, we were taught, every organization does have some standard things you should be able to benchmark. Well, throughout my career, I've learned every organization is unique. Every patient population is special. And therefore, these off-the-shelf leadership programs that we can often see out there, sometimes those just don't work. What I love about Keturah and Dr. Harrington is that they were specialists and leaders and experts from within that are building these programs specifically to the needs of our teams, of our patients, of our physicians. And that to me is incredible. And yes, those sometimes do cost a little bit more money, but I do think the payoff is tremendous. And if you think about how do you measure that, we all look at the same thing. It's reducing turnover, it's retention, it's looking at the cost of burnout and all of the things that come in, which we can tally those, we put those out in front. And yet still, I think organizations are loath to invest in leadership development program because can we really measure it? And I'm all about giving hacks to people about how do you crack the decision-making model in the C-suite, because I do think executive leaders have to level up in this process as well. If we were to think about the investment we make in leaders to really serve and elevate the potential of our people, those people, both patients as well as our teams, they are brand ambassadors. If you think about 5,000, 10,000 employees that are out in our community as brand ambassadors, how much money would it cost to pay brand ambassadors outside of your organization? These leadership development programs become a bargain at that point. And I think we can demonstrate high yield, high return on investment. And I think it's just critical for us to continue to invest in leaders to support our teams.
I love what you said, John. And there's a thought I have, which is, we need to set those metrics. Metrics like 50% of our leadership positions will be filled from within, or some commitment. Because it really, Jennifer, I think circles back to the trust question from the beginning. When you have vacancies and then you have interim leaders for extended periods of time, there are so many costs to that, not just in trust, but in productivity. And I've worked with organizations where you have interim leaders reporting to an interim leader who was reporting to an interim leader. And, that to me is what we want to avoid. We want to build a pipeline, and you want to have capable people who can step in, who know the culture and who are ready to assume leadership.
Well, one of the things I think you both spoke to that I think is important, and Dr. Harrington and Keturah can probably speak to this, is the importance of that sponsorship and commitment of the CEO and the C-suite to this kind of work. It just can't be housed in a OD or an HR or, one part of the organization. So anything either of you would add around kind of just both the decision to make that investment, which is, is not insignificant from time and resources, but also, the beginnings of the impact that you're seeing. Cindy, you spoke to some of that, but just in terms of leadership commitment to this.
I'd recommend that they take a look at the cost of replacing all of the talent as the talent goes out the door. And if we believe what we're hearing, there is going to be a talent deficit hitting healthcare of an enormous proportion, 2025, 2026, and we're already seeing some of it now, which I don't think any of us can really afford after we're coming and surfacing out of COVID. And so I think that we are going to have to respect our talent, invest in our talent in a very serious way so that we retain our talent.
Mm-hmm.
And I would just add, it's 100% worth it for all the reasons that have been stated. I think too, it decreases when you think about onboarding and bringing individuals in and the time that you take. And I always think there's a balance. I think Leslie said set a goal like 50% internal. There's always going to be a balance, but it helps to continue the momentum of initiatives that have been started to when we think about John saying, and from healthcare space, it is a space of people and understanding our patients that we're serving and why we're here. I think it is absolutely worth it to invest in your team, because when your workforce is satisfied and also knows how to work with each other, it shines through for the patients and the families that we see. And so it is worth it in so many different ways.
Yeah, one of the things, Katura, that strikes me is, what some of the ripple effect is, building those networks and communities within the organization as people go through these programs and build strong relationships with each other that they know then they can tap into each other. We know healthcare has a reputation of having silos, and how to break down some of those silos. So as leaders are developing, when they get to that enterprise level, they can take that enterprise perspective and have those relationships across the organization that help them do their work better, and frankly helps the organization achieve some of the goals that are required, that require all of the organization to be aligned and committed to doing that. So I think that's really an important aspect around this. So I guess just in thinking about getting towards closing here, we've talked and covered a lot of things as it relates to not only the trust gap, but what's driving that, some of the important of purpose and how you can leverage the power of that, leveling up leaders, and looking at both programmatic and personal development of leaders in a way that shows that the organization cares about leadership and is willing to make that investment, which cascades. I'd love to hear from each one of you one kind of crucial piece of advice or closing thought that you'd want to give to our audience around what to be paying attention to, or that one thing that is in your mind most critical on this topic.
Well, I'll jump in just very briefly. First of all, thank you. This has been an incredible panel, and the insights shared today has been incredible. I think my bit of advice is we think about helping others reach their potential or move past their current boundaries or elevate to a new level in their leadership. I think the most critical piece of advice that I could share with you, which was shared with me, and that's, I think, how great leadership is. We just share these great anecdotes, is a mantra that we have within FMG Leading, which is leaders go first. And that is, we can't expect our teams, we can't expect our leaders to move past their current boundaries or elevate to a new height unless we have done that as well ourselves. The credibility, the authenticity, the trust that we can bring in helping and guide others to create new boundaries and to create new potential within themselves and thereby in the organization, we have to do that work ourselves. And so that would be my bit of advice.
Thanks.
I will echo, this has been an incredible panel and wonderful insights across. And I would say that my advice is listen. And I think we started with that of get curious, understand if you're not hearing anything, that's a problem. If it's only your decisions, that's a problem. And I think, how can you listen and then connect together some of the different decisions that have incorporated the feedback that you're receiving across your organization?
I love that multidimensional listening. And I know some organizations I've heard have created as a routine listening circles, right? So really creating those circles of listening in a powerful way. So it's not just in a crisis or awkward, but actually part of the fabric of the way that they do things. And that's a great strategy to do what you're talking about, Katura, as well. So Leslie?
I think the one that comes to me, and is probably the one that my sponsor / mentor impressed on me, is take a risk. So I tell the story when we do development programs and I'm talking to people who've been already identified as high potential, and I say, you know, what I learned about sponsorship is people want to sponsor you. They want you to show what you got, and they want to see that you're willing to take a risk. And I had to be nudged earlier in my career by a sponsor / coach saying, are you just waiting for people to find you, or are you letting your intentions be known? And so I think those are the risks. They feel scary, but they're the ones that are really pivotal. And it goes back to what you're saying too about John and Keturah, about being aware and listening. So it's not just listening to others, but listen for cues and listen for opportunity.
Thanks. And Dr. Harrington, what advice would you bring us home with here?
It's great to follow right after Leslie on this one, and I agree. This has been a phenomenal panel. We could go on for probably another hour easily. But your future leaders are likely sitting in your own organization now, and wouldn't you want to interact with them when they are young and developing, and you could influence their leadership development? And like Leslie said, they may be scared to take the risk. And the outcome of investing in your own young leaders will result in a great leadership pool and bench depth that you can reach out into. The positive outcomes are very high. And so I would encourage you to take a big risk on the individuals you have in your own institution.
As our founder has been fond to say, is play big, right? And so I think that's at both an individual leader perspective and as an organizational perspective. You know, now is not the time to stand back and see what's going to happen as it relates to leadership. As they say, both with cultures and with leadership, if you aren't intentional about it, right, you will get a culture, or you will get leaders, and it may not be aligned with what you need and are hoping for as it relates to driving impact, as it relates to mission, vision, outcomes, and really providing care for those that are needed. So well, it looks like we're close to time, and so we'll be happy to follow up after this around questions that have been put in the chat. But I just want to thank everyone for joining today, and especially thanking our panel for their time and insights. We hope this has been informative to each of you as you continue to identify ways to lead with greater purpose, to build trust and belonging in your organizations. And so thanks for your time today.